The real question is, why would something that's fairly basic like a diet and just being healthier and having better metabolism, why would that not be part of standard medical practice to teach and to espouse for our patients? And why would we not have tried this earlier for brain tumors and all that? I've asked myself that question a lot. It's something that seems to be kind of a perfect storm. I don't really believe in conspiracy theories. I don't really believe that people have purposely tried to avoid this therapy for patients. I think that, I'll borrow the title of a very good Netflix documentary, The Magic Pill, which I think is wonderfully done, that people really want a magic pill. And when Otto Warburg kind of proposed the ketogenic diet as a metabolic treatment of cancer, or idea of cancer, it was new and novel, and back then it was way before you had any understanding of chromosomes and of DNA and all of that stuff. So everybody kind of got down the rabbit hole of just following genetic disorders and DNA damage and that whole concept of that causing cancer, the somatic mutational theory of cancer. And just kind of forgot about the metabolism, didn't go down that road. And I think that from my recollection of nutrition in medical school, I think it was based on lowering cholesterol. That's all I remember from nutrition in medical school. In fact, doing an experiment on ourselves we had to do as a first-year medical student was see if we could change and lower our cholesterol level by changing our diet. I did that on myself. I actually dropped my own cholesterol level by eating more, high-fiber grain cereal, something like that. And that's what I remember. We knew nothing about ketosis or other than metabolic ketoacidosis as being a bad thing. And then if you fast forward that to think about epilepsy. It was known back in the 20s and 30s you could do a ketogenic diet and treat epilepsy. But once anticonvulsants became discovered and people could take a pill and doctors could prescribe a pill, it's way easier than talking to them for hours or follow up on all their diet and all the restrictions that happened. And then there's the food industry, right? It's like it's developing food that tastes good and is even addictive, from sugar, and this whole the grains and the food pyramid and all of these things kind of happen, and I think the end result of that is a terribly unhealthy standard American diet and an escalation of many diseases that are happening, not because anyone wanted it to happen, but it's just kind of the profit motive of America just ends up with a perfect storm of many, many bad things that happen to our health. And now we're trying to reverse all of these trends that have been going on for the past, 30, 40 years of a low-fat diet, which turns out was not based on good science. It's actually very bad for our brains to have low-fat diet. We need healthy fats for our brains. The Alzheimer's epidemic that's happening now in America, I'm convinced it's actually a result of many years of the baby boomers being told that cholesterol is bad for your brain. It turns out we need cholesterol for our brain, and so what we need is better treatments for avoiding hypertension, avoiding inflammation. We don't need low cholesterol. Dr. Daniel Diamond is very good about his whole podcast on the cholesterol myth, but this is something that is just fighting uphill for the standard medical practice. I find myself at my hospital being considered like, oh, he's the keto guy. He's this guy that pushes this for everything. It's like, yes, but it's not just not pushing ketosis for everything. I'm just trying to educate people that what we've been doing for the past 30, 40 years and the diets that's changed away from really a more optimal diet for brain health, for anti-inflammatory health, to decrease the risk of cancer and actually to treat it after someone has it. I think these are things that are just not part of standard medical training or practice, and we've been giving pills to everything. And just a lifestyle change, a holistic approach seems kind of foreign to the modern medical model, but I think needs to be really brought back into it.